Let's bring in the Surgeon General, Jerome Adams, for more this morning. Dr. Adams, thanks for joining us again this morning. You've been vigilant about wearing masks, about telling people to wear a mask, but is this effort being hampered by mixed messaging from the broader president's team?
Well, it's really concerning to me that we still have people out there who don't understand how much spread is occurring by people who don't have symptoms, who think they're fine, and then we find out a week later that they've tested positive and they've exposed other people. That is very concerning, but more people than ever are wearing masks. I want the American people to know this virus is incredibly unforgiving. Cases are going up, hospitalizations are going up. My colleagues are dog-tired, and we need you to hang on just a little bit longer because we've got vaccines coming. But we want as many people to be alive to get them as possible. And a lot of that's going to depend on your behavior.
And you talk about the vaccines. Pfizer is releasing its trial data today. We're having those key FDA meetings later this week. What's the most important thing you need to learn about the vaccine right now?
Well, the most important thing for me personally is making sure people understand that these vaccines were developed safely, that they are over 90% effective, and that it's a way that we can ultimately end this pandemic, but it doesn't matter if people won't get the vaccination. We know that vaccine levels are only about 50% for adults for flu, and they go down to about 40% for African Americans. So I'm working with historically black colleges and universities, faith communities. I'm working with the Divine Nine, which is the leaders of the African-American fraternities and sororities, working with Hispanic leaders. We want everyone to get this vaccine when it's available, which is why we're having a vaccine summit at the White House tomorrow, and we'll be talking about vaccine confidence. And one thing you can all do right now, it's National Flu Immunization Week. Get your flu shot because 500,000 people were hospitalized last year for the flu. We simply can't afford for that to happen this year, with hospitals being overwhelmed.
We want people to take the vaccine once it's available. We know that healthcare workers in residential facilities, elderly in residential facilities, are going to be first in line for the vaccine. Who should be next? There's this debate about whether it should go mostly first to essential workers versus the elderly who are most vulnerable.
Well, we want to immunize for impact. We want to make sure we're giving it to the people who are most likely to die from this virus. And we know that 40 to 50% of the deaths are occurring in people who are in long-term care facilities or older. But we also want our healthcare workers who are on the front lines to be able to get it. This surge is different than earlier surges because it's not about PPE. It's not about testing. It's really about healthcare capacity. And certain places are just being overwhelmed. So we know that we can actually help them with their healthcare capacity by immunizing their health care staff. We're going to leave it up to the states, but we're going to give them guidance. And some states are going to have to immunize their health care workers first. Others are going to find they get impact by vaccinating older people and people with vulnerable conditions first. But about 20 million doses full doses are going to be available by the end of this year, and we'll keep pushing vaccines out to people as quickly as we can so that we can end this pandemic. But follow the 3 W's. Wear your mask, wash your hands, watch your distance, avoid people outside of your household as much as possible, and please be patient with your leaders around the country. They're trying to preserve hospital capacity. They want you to be able to have a bed. They want my sister who's pregnant to be able to have a bed if she comes into the hospital. My mother who had a syncopal episode a few weeks ago to have a bed. And that's not going to happen if we keep engaging in behaviors that lead to the spread of the virus.
Dr. Adams, thanks for your time this morning.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.